Evening. Welcome back to the channel.
Today is Monday, May 18, 2026, and we are bringing you a massive slate of breaking medical news that is reshaping healthcare globally. First up, the U.S. Food and Drug Administration, FDA, https://www.fda.gov, has officially supercharged early-stage breast cancer treatment.
The agency just granted two massive approvals for the blockbuster drug Enhertu, famtrastuzumab deruxtecan.
Asterisk before surgery, it is now approved alongside standard targeted therapies for high-risk stage 2 and 3 HER2-positive breast cancer. Clinical data shows it achieved a complete response rate of 67.3% compared to just 56.3% with standard chemotherapy. Asterisk after surgery, for patients with residual invasive disease post-surgery, Enhertu slashed the risk of cancer returning by an astonishing 53% over 3 years compared to previous treatments.
This is an absolute game-changer in oncology.
Alongside this, the FDA cleared Vepanu, vepdegestrant, a first-of-its-kind oral PROTAC estrogen receptor degrader. Instead of just blocking estrogen, this pill literally instructs the cell to destroy the cancer-fueling receptors entirely. Segment 2, the rising hantavirus and global climate alerts. Turning away from oncology, the World Health Organization, WHO, is responding to a sharp public health alert. Leading international experts have officially petitioned the WHO to declare the climate crisis a global public health emergency. They warn that rising temperatures are driving rapid, unpredictable shifts in vector-borne diseases globally.
We are seeing the real-time impact of this right now. The WHO just issued updates on a virulent hantavirus cluster linked to international cruise ship travel. A single ship carrying 147 passengers and crew experienced a rapid severe respiratory outbreak, resulting in multiple cases of acute respiratory distress syndrome and 3 tragic fatalities. Health experts point out that these spillover events are no longer anomalies. Deforestation, industrial farming, and climate volatility are pushing rodents, bats, and mosquitoes into human environments faster than ever before. Check out this direct breakdown from global health teams on the reality of the situation. Segment 3, the zombie cell cure for liver disease. Visual, 3D animation of cells, highlighted text reading, senescent zombie cells. Next, a phenomenal anti-aging and metabolic milestone. Published in Nature Aging, scientists have successfully reversed severe fatty liver disease in lab models by targeting what they call zombie cells. Formerly known as senescent macrophages, these are damaged cells that refuse to die. Instead, they linger in the liver, pumping out inflammatory signals that drive tissue damage. Researchers found that while young models hold only about 5% of these zombie cells, older or high cholesterol models see that number skyrocket to 80%. By administering a targeted therapy called ADT-263, they selectively destroyed these cells. The results? Fatty, enlarged livers shrank back to a healthy size, and overall inflammation plummeted, all without changing the subject's unhealthy diets. While this specific compound is currently too toxic for direct human use, it provides a brand new blueprint for treating human metabolic-associated steatotic liver disease. Segment 4, sleep apnea pills, silent heart attacks, and microplastic flushing. Let's run through today's top clinical trial findings presented at the 2026 ATS International Conference and published across Science Daily, https://www.sciencedaily.com. 1. The sleep apnea pill. A massive phase 3 clinical trial has verified that a once-nightly oral pill effectively controls obstructive sleep apnea, potentially freeing millions from bulky CPAP machines. 2. Silent heart attacks and the brain. New research highlights that silent, asymptomatic heart attacks are a primary driver of accelerated cognitive decline. Identifying hidden cardiovascular risk factors is now deemed crucial to preserving brain health and preventing early dementia. 3. Flushing microplastics with kimchi. In consumer health news, scientists in South Korea made a fascinating discovery. A specific probiotic bacterium found natively in kimchi binds tightly to nanoplastics in the digestive tract, flushing them out of the body before they can accumulate in human organs. Segment 5, National Healthcare Disruptions, India Focus. If you are watching from India, there are 2 major developments shifting the local healthcare ecosystem this week. First, a massive nationwide protest is underway. The All India Organization of Chemists and Druggists, AIOCD, has announced that over 15 lakh chemists and druggists will completely shut down their medical stores on Wednesday, May 20th.
They are striking against corporate competition and the illegal online sale of prescription medications and antibiotics without valid doctor notes. If you need regular medication, fill your prescriptions before Wednesday. Second, the National Medical Commission, NMC, officially launched the National AI Doctors Mission. NMC Chief Dr. Abhijat Sheth clarified that artificial intelligence will not replace doctors, but will dramatically evolve medical practice. The mission aims to establish standard ethical boundaries, bridge the gap between rural public clinics and private hospitals, and build AI literacy across the country's medical workforce. Preventing nephrolithiasis. Evidence for preventing nephrolithiasis is limited, with pharmacologic strategies like thiazides and allopurinol showing potential benefits. Dietary interventions, such as increased fluid intake and specific diets, offer limited support. Lemon juice raises caution due to adverse effects. Medscape. High doses of vitamin A. Vitamin A helps your vision, immune system, and many other parts of your body. But too much of it can bring health problems for your liver and the rest of your body. Here's why: your body stores vitamin A, and you don't want too much to build up. Symptoms of too much vitamin A from supplements include headache, nausea, dizziness, and liver damage. High-dose supplements of beta-carotene, a form of vitamin A, may also make lung cancer more likely in smokers, people who used to smoke, and those who have been exposed to asbestos. A safer way to get vitamin A is through foods such as certain fish, including salmon, spinach, carrots, cantaloupe, and apricots. Think of green, orange, and yellow fruits and vegetables. If you think you still need a supplement, stick to the recommended levels. WebMD. Insomnia. Weight gain. When you get less than 6 hours of shut-eye a night, you may have more body fat. About 8 hours is the sweet spot for maintaining a healthy weight. Lack of sleep can cause your body to make too much of the hormones cortisol and insulin, which can lead to unwanted weight gain. It also can mess up your hormones that signal hunger and make you crave food, especially those loaded with fat and sugar. WebMD. Outro and call to action. Closing script that wraps up your global medical update. Which of these breakthroughs or emergency updates surprised you the most? Drop your thoughts in the comments section down below. Don't forget to like this video, subscribe to the channel for your daily dose of science, and hit that notification bell so you never miss a breaking report. Stay healthy, stay informed, and I'll see you in the next video. Disclaimer: compiled information. This content is for educational purposes and is not a substitute for professional medical advice. The audience/viewers must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.